It's my feel-good breakfast show.
Definitely the man with the best intro music in the business. He is here along with the prof. We're going to have a very important discussion this morning. Every year on the 17th of May, we observe World Hypertension Day. The consequences of high blood pressure puts you at risk for serious medical conditions such as heart disease and a stroke, among other things. It's imperative for us to encourage the prevention and control of hypertension, which is well within our control, also known as the silent killer throughout the globe. It's not just a South African problem. Now, our clinical psychologist and CEO of the Heart and Stroke Foundation, Professor Pamela Naidoo, and our trusted multimedia health expert with the best intro music, Dr. Darren Green, are going to tell us a bit more about this very common medical condition. If you have any questions, we'd love to hear from you. 021 110 5552, or you can just pop onto our social pages and drop your questions there. Prof. Doc, great to have you.
Good
here.
morning.
Always good to see you, and you got the monochrome
Morning. Yes, we are all
wardrobe as
matching
well.
all
Well
the
done.
way. Yeah. Well, Prof. Naidoo, my first question is to you. I know it's so important for us to celebrate all of these different days, but you know, on the 17th of May, it's World Hypertension Day. What exactly are we putting the focus on?
Right. So in public health, so just to add, I'm a clinical psychologist. That was like years ago, but I'm more kind of recognized in my public health. So let's talk about public health and not the psychology of it.
Go away. Before you say that, let's see where this conversation goes, okay? We're feeling pretty raw here. We might need to lean on those skills.
Yeah. So in public health, we would usually put the focus on any condition that has an increased prevalence, or the numbers of people that have it, and then incidence, or the number of new cases that happen sort of on a week-on-week basis. And hypertension is a key risk factor. It's prevalent worldwide. So you have at least, if you take sub-Sahara out of the equation, sub-Saharan Africa, you've got at least about a 30 to 40% prevalence of hypertension.
Wow.
And in South Africa, particularly, you've got almost half of the known cases. You know, now we're not talking about the unreported cases.
Yeah.
So you're looking at anything between a 50 to 70% range of adults who are hypertensive. And it's a driver for any circulatory disease, including heart disease and strokes. So the World Hypertension League, which is a global body that we take a lot of our direction from, you know, every year they emphasize the importance of knowing your blood pressure. But this year, Darren, Dr. Darren, is the emphasis is on knowing it and measuring it accurately, which you're going to talk about a little later.
Absolutely.
The Hypertension League.
That sounds fantastic.
It sounds like a
Secret
superhero
organization.
league. I want to join it.
But no, you don't want to join it.
Yeah, well, exactly. The prevalence is numbing. In fact, it's part of the human condition. Now, explain to us exactly what it is. Hypertension, high blood pressure.
Yeah, so we need a degree of pressure within the closed pipe system between the heart and the blood vessels. It's like a sprinkler irrigation system in your garden. We need pressure in those pipes to push the blood to the extremes and the end arteries in the fingers, the tips of the toes, and the brain, and all the vital organs as well. But the issue is, if you put that pressure under a cooking pressure and you raise that pressure, what happens is you have then, due to the long-term effects of stretching those blood vessels and pressure in that system, you start then seeing changes that occur in the blood vessel or the pipe walls, as well as the target organs like the heart, like the kidney, like the brain, because of that long-standing pressure. There's structural changes that occur with those specialized cells in the blood vessels that lead to problems in each different system. And depending on the cause and where it's coming from, we need to target and reverse as soon as possible.
Okay. Well, Dr. Darren Green, I really want to know from you when we get back with our second part of the medical chat is how to accurately read and understand your blood pressure. Because whenever I go and donate blood or they take my blood pressure, there is rattle of numbers, so many over so many, and like, that's good. And I'm like, I don't know what that means. I don't understand it. So I'm hoping
she doesn't belong to the league.
No. I'm missing out on that. But please, if you have a comment or a question as we highlight World Hypertension Day, you can head on over to the Expresso Facebook page page with your questions, or feel free to call us. Our number is 021 110 5552.
It's my feel good breakfast show.
Welcome back as we continue to commemorate, to mark World Hypertension Day, celebrated or commemorated on the 17th of May. I don't know if we should be celebrating it. And we are joined by Professor Pamela Naidoo and our trusted Dr. Darren Green. Thank you so much for sticking around, guys.
Yes, and you know what? We are talking about World Hypertension Day, high blood pressure. Dr. Darren Green, when they give you the numbers taking your blood pressure, what exactly does it mean? Which numbers mean this is
What
good
is over
or
what?
actually this is alarming?
Yeah, so firstly be aware that there are differences in your blood pressure according to the time of the day. Morning versus lunchtime versus at night time, etc. So
Presumably they'll take that cognizance of that when they're reading your blood
correct,
pressure.
and
Okay.
also whether you've had a chance to not be stressed, relax in a quiet environment, and so forth. All right, and you're not anxious about the white coat of the doctor or going to the doctor's room to get a bad diagnosis, because that also pushes it up. So does your emotional condition at the time.
So
as
does
well.
coffee.
Yeah.
So
Yes,
does coffee.
and coffee.
Really?
Yeah.
Wow.
So be aware of that, firstly. And then secondly, the right sizing of the cuff is very important, and the position that they take it in. Are you taking your blood pressure lying down, or are you taking it sitting? And generally, they take it at the level of your left arm, and the level of the arm obviously must be at the level of the heart. And the size of the cuff must be 2/3 of the distance between your elbow and your shoulder, basically. That's the right, because you get obese cuffs for people with bigger arms, and you can diagnose everyone with hypertension if the cuff size is incorrect. So remember that, and also remember values. We're going to get to values quickly, but normotension values have changed. So everyone understood 120/80 has to be the golden figures. And what research has shown is that the health benefits of having a normal blood pressure under that, we're speaking about 110/70, are even more advantageous, and that's what we should be aiming for. So you need to know the signs and symptoms of low blood pressure in order to manage that as well. So remember, women have a lower blood pressure target than men do, and a lot of it's got to do with the muscle mass, the lean body mass, and then children as well also have different reference parameters.
We can have a whole conversation just on
Yeah,
understanding
man, I'm
blood
like-
pressure.
You've just now sparked. I need counseling from a clinical psychologist because you've taken us down a different route. Let's get down to business. What causes high blood pressure?
Right. So essentially, I think it's so important for any medical condition. It never exists in a vacuum. You know, it's not just a disease. You've got biological factors. So you've got, familial history. So your genetics can be a driver. Then you've got the psychological factors and then the social factors. So psychological meaning your behavior. So what is it?
Stressful job.
Well, stress as well, but it's also individual choices.
Sitting on the couch.
Exactly.
For hours on end.
So that's why I actually don't like the word lifestyle, because it
okay.
kind of doesn't really speak to the real issues. It's really about how you
it's
eat.
passive, it's
the
not-
kind
these
of
are choices,
the
yeah.
intensity of your physical activity. It is about your life choices, yeah. But so perhaps what I can do is, so there's so many behavioral issues, right? But I think salt is a major driver of hypertension the world over. So it's unfortunate. So, earlier informally we were chatting about, well, is it sort of social disadvantaged people who,
Yeah, is it a
or
socioeconomic
economically
problem? Yeah.
And yes, to an extent it's true, but it's also people who can afford to eat out, will eat out and not know what's in the food. So there's increased levels of salt there. And then people who can't afford to eat out in a restaurant, for example, will buy fast foods or street food, and then you've got loads of salt in there.
Yeah.
So it's, it's different kind of reasons, but it's got the same effect.
outcome.
Yeah, so it's quite complex.
There's so many hidden sources
There's
of
so
salt
many
in our
hidden
food.
sources.
Sauces, processed meats. And we love our braaivleis in South Africa, for example, and
biltong.
seasoning. Biltong, drovos.
There we go.
Well, yeah, the one thing we know.
That's right. Well, now we know the various reasons causing hypertension, but we also need to know which signs and symptoms to look out for. So we'll be unpacking that with Professor Pamela Naidoo and Dr. Darren Green. They are not going anywhere. And if you have a comment or a question, you can head on over to the Expresso Facebook page. But the doctors and the professor will be back soon as we unpack World Hypertension Day.
It's my feel good breakfast show.
You tuned into your Feel Good Breakfast Show on S3, and you're just in time as we are back on the couch with Multimedia Health Specialist, Dr. Darren Green, and CEO of the Heart and Stroke Foundation South Africa, Professor Pamela Naidoo. They are standing by to answer your questions as we've been unpacking World Hypertension Day.
In fact, we've got a caller on the line right now. Joy is joining us from Durbs. A very good morning to you, Joy. What is your question for our panel?
Good morning, Doctor. My question is about the pressure. I've had pressure since I was 36. And it's been a bad one. It's been like, I used to suffer like 220, over 120 for many years now. And I'm old now, I'm 73 years old, but the problem hasn't gone away. And I've been taking tablets all my life. So now my question is, what can I do? Because my heart beats so fast that it's about to jump out of my chest. And then it will suddenly rattle and clench like it's about to stop, like a fist, and then it opens up again. And I just don't know what to do. Thank you, Doctor.
Thank you, Joy. We can hear the anxiety and understand the anxiety in your question, Doc.
She's now in her 70s, and I believe the diagnosis started at 36.
36 years.
To live your whole life with that.
Long-standing hypertension. The first thing that Joy needs to realize is that blood pressure is not controlled. At 220 over 120 right now, she's at great risk of what we call target organ damage. Now, you get target organs like the kidney, the brain, the heart, and so on. That happens over a long period of time. But an acute insult in terms of having what we call malignant hypertension is very, very indicative that she needs to be examined afresh by a physician that looks at signs of blood vessel involvement in the eyes, the kidneys. There's a urine test that needs to be done. The kidneys need to be reevaluated because it's a very interchangeable condition medically. If there's a problem with the blood vessels, it can cause the blood pressure to go up. If there's a problem in the kidney, it can cause the blood pressure to go up.
Sure.
So one needs to look at where she's at right now, take a new picture of this journey and also her medication and why the medication she has been on for a long time is now suddenly not working anymore.
Not managing it.
And then secondly, also whether the other interventions that are non-medical also are being maximized to bring down this blood pressure.
Okay.
Correct, yeah. Just to complement what Dr. Darren is saying, I think it's really important to not become helpless in the situation, you know, because you feel you're trying hard enough and it's not making too much of a difference. But I think the constant would be to retain the good lifestyle. You know, just watch your diet, continue to walk or run or whatever you do to keep healthy. So it's to keep the constant, the positivity.
Okay.
And not get lost in the helplessness of it.
I suppose, Joy, the one thing you've got in your corner is the fact that you've dealt with this for a long time, that you know probably more than most people would know about a condition like that, but you've got to get back in to see the doc. That is absolutely vital. Then we've got Charmaine joining us on the line from Cape Town as well. Charmaine, a very good morning. How are you?
Good morning, Doctor. Doctor, I suffer from hypertension. I was for 3 years on a 2 mil in natural high blood pressure, but I think doctors made a mistake and they gave me a 10 mil in VAS tablet for about a month ago. I also had a stroke 3 years ago, but now the new tablet, the new milligram that I'm using is giving me a slight headache. And I didn't see the doctor before because now during COVID, the tablets were delivered. So I'm sure maybe whoever it was pre-packed, I think they made a mistake with the milligram. So I would just
She raises an important point.
Sure.
Checking the dosage of your medicine when you get it, when you receive your medication from the pharmacy, check that it's in fact the right dose, double check, etc.
How much of a difference would that make? Because that seems like quite a step up from 2 to 10
the drug she
milligrams,
mentions is enalapril, which it falls into a category called the ACE inhibitors. It's a converting enzyme that controls the balance between fluid kept and fluid lost in the kidneys. And what's important about it is if the dosage is incorrect, obviously what you'd have then is a great fluctuation in blood pressure, which causes the headache that she's alluding to. So often when people haven't taken their medication for, let's say, a week because their script has run out or if they've just forgotten, and they start taking it again, there's an adapting phase that has to happen where you do develop headaches. When you lowering someone's blood pressure that suffers from high blood pressure on medication, as it's coming down, they will feel initially, obviously, a little bit of side effects in terms of normalizing that with headache, lightheadedness, etc.
Well, Dr. Darren Green, we are running out of time, but is a headache one of those things you need to look out for if you're suffering from hypertension without knowing it?
Yeah, so primary headache is not a symptom of hypertension. So that's the first thing. Everyone thinks that's the main symptom. The main symptom of the silent killer is lightheadedness, and sometimes even a little bit of nausea that can occur, and fatigue, extreme fatigue that is not explainable by other methods needs to be investigated.
And I would say, because we have to unfortunately wrap it up, if you are living an unhealthy lifestyle, chances are, looking at the prevalence of this, 50 to 60% of South Africans are living with it. Chances are, if you're unhealthy, you have hypertension. So go and get yourself checked out, do it regularly. If you have that voice in the back of your head, go and see your doctor.